Hello, good morning. How you doing? So I want to share this I want to talk about something that I know most women are not aware of, and it is called mastitis. Mastitis. Now, when I was pregnant for I don't know which of my pregnancy, so I don't born plenty. I was pregnant for one of my child. I just woke up one morning and I saw that my breast was engorged, painful. I couldn't lift my hand up. I'm like, I'm actively breastfeeding. I'm actively breastfeeding. Why will my breast be engulfed? Painful, and I had fever. I couldn't explain what was going on. I said, okay, let me observe if it will, if I breastfeed well. If I breastfeed well, let me just see if it will reduce. 2 days it was hard. Couldn't lift up my arm, couldn't put my breast in my bra to wear a bra was a challenge. I'm like, God. So after the second day I couldn't. I went to the hospital. And in short, I went to a big hospital. I was prepared for, you know how you just prepare your mind for worst case scenario. That was what I prepared. So I went to a big hospital just in case I would need to do mammogram, all those plenty things. So I went there. I was in distress. I'm like, please, I don't know what's happening in my breast. The doctor examined and said, ma'am, you have what we call mastitis. I said, what's mastitis? Waiting be mastitis? Like I just imagined the biggest thing. They were like, it is an infection or inflammation of the breasts that usually occurs in pregnant women. Now, what causes mastitis? Number one, for those mothers that breastfeed their baby, especially when you are not exclusively breastfeeding your baby and you refuse to clean your baby's mouth. Now, those milk particles in the mouth that you reintroduced into your breast, especially if you have your nipples cracked, you have a cracked nipple, you have an injury in your nipple. Now, those milk will get access. Those milk particles will get access to your breast, one of the dots in your breast, and causes an infection there. Okay, that's one. When you don't clean your baby's mouth properly. That's why I read somewhere like, how soon should I clean my baby's mouth? I'm like, why will you be asking how soon should you clean your baby's mouth? Like, I clean my children's mouth from day one. Even with the cleaning, imagine I still had mastitis, maybe on one of the occasion, maybe one afternoon, because I knew I used to have cracked nipples. So I had just gone to introduce the breast to the baby, and that was how I got it. Me, when they clean my pikin mouth, get mastitis. So that's one. Then secondly, putting on of bras that are too tight. You are breastfeeding mom, and especially for moms that are working class mom, you know, before you're not expressing your breast milk. Now, when you get to the office, your breast is swollen, already full. Then you're putting on a tight bra. Those things can block one of the dots, DUCT dots, in the breast and can cause mastitis. There are different factors. Clean your baby's mouth to avoid mastitis. Avoid wearing tight bra. Proper hygiene. If you know you sweat so much on your breast, please, especially if you have a sore on your nipple, you have a cracked nipple, please take care of these things to avoid mastitis. Now, if you notice that after all said and done, you have mastitis, what do? You go to the hospital. Now, how you really know you have mastitis, it happens to just one breast, not the two. It's usually red, painful, then you have fever, as if, you know, when you want to wean your baby, when you want to remove your baby from breast, how your breast is usually engorged, but this one, you will see it is red on one breast. One side of your breast will just be red, hard, you have fever, you can't do anything, it's just on one breast. So what do? Please go to the hospital, you see your doctor, they will place you on an antibiotics and it will resolve. Okay, so if you notice this kind of symptoms on your breasts, I'm doing this video so that you will not panic. Go to the doctor. Don't think of worst case scenario. Go to the doctor and try to practice better hygiene. Okay? Clean your baby's mouth as often as possible. Wear bras that are not so tight. If you notice that you sweat so much in your bra region, in your breast region, please bathe at least 2 times a day. And before you breastfeed your baby, try to clean. I know most of us don't do it. Even me, I fall guilty sometimes. Try to clean your nipple area before you introduce your breast to the baby's mouth. Try to clean the nipple area before you introduce your breast to the baby's mouth. So I hope this video helps. Have a wonderful day. Bye.